Welcome to our discussion today, HIPAA Compliance Management for Hospitals. A few things worth mentioning. We are recording this webinar and we'll send a link to those that are attending and also those that missed it. You're welcome to forward that along. The second thing is please feel free to ask questions in the chat area as we're going through the discussion. A lot of times we'll have relevant questions to the specific topic. We'll get to those real time, and in addition, we'll have a few minutes at the end to address those as well. We do have a few questions along the way as well, so designate somebody in the room to answer those questions, and you can point to, it's kind of a majority rules, point to that individual that's going to answer those questions for the organization, and we'll share those results real time. I think you'll find those responses pretty interesting.
And they're multiple choice too, really easy.
Absolutely.
No pressure.
So there's no fail here. So anyway, let's get started. So my name is Bobby Sigmiller, SVP of Business Development. Have been here since the beginning. Stephen Marco.
Hello, Steve Marco, President and founder of HIPAA One. Been here for 9 years and counting.
A long time. So today's agenda, we have a lot of hospitals on the call today, and you may work with small practices, clinics, different business associates. The content that we've put together and that we'll be covering today, it's going to be basic in some areas. Some will drop a little deeper, might go over some of your heads, but we'll do our best to ensure that you leave today with some valuable information, things that are actionable, things you can implement immediately. So our agenda, we're going to talk about data breaches, HIPAA violations. They're becoming more commonplace. Why is that? And we'll address that a little bit later. What are some of the barriers to achieving a successful HIPAA compliance program? Understanding, what changes have taken place. What do you need to know for 2021 that you didn't know last year or that's new? We'll hit on high level a couple of those, topics, and then also talk about different approaches that you can take to perform a HIPAA security risk analysis.
Thank you, Bobby. So one of the things that we need to look at, I'm going to start with updates. What is happening? But if we start looking at the cybersecurity breach data and what the actual enforcement is in terms of resolutions from Health and Human Services, the Office for Civil Rights here, they will audit, they will review complaints, breach reports, and they'll do audits and depending on the situation, apply corrective actions, and in some cases civil money penalties as well. Those are the cases where there's a lack of due diligence, and we'll go into why that happens. But up here on the screen, I hope you can see it. It's this is actually public information, hhs.gov, and this is just compliance enforcement, and this shows all of the civil money penalties that are that have been deployed this year and going back, and the screen we can only fit, even though it's small text, just to the middle of last year. So even though COVID was happening, there was still quite a bit of enforcement happening in terms of making sure that folks are doing this. Now, why are these civil monetary penalties applied? Twofold. One, they're applied because during the investigation, there was just a lack of care. Or maybe everyone in the organization had good intentions, but they were assuming someone else was taking care of the security, of the risk analysis, of the ongoing blocking and tackling of these cybersecurity attacks. The other side is more, it's more of a philosophical approach. The goal of the OCR, Office for Civil Rights, is not to make money from this. They do fund part of their operation and enforcement activities through these CMPs. However, the goal is to stop breaches before they happen. That's the whole purpose of this. So by enforcing and showing, making everything a public record, the intent is to get folks to wake up and start really paying attention. On the flip side to this, there's always, within our government, there's always two sides. As you know, there's the left and the right. There's the one side of the house and the other side of the house, and one of the things that is positive in all this, in January, this House bill was signed into law by President Trump, and it does two things. One, it's basically saying that the Health and Human Services, which the OCR is a division of Health and Human Services, HHS, may reduce the fines and penalties for violations of certain federal privacy standards for health information if an entity subject to those standards has adopted particular cybersecurity practices. So that's half of it. What that means is if you're doing a HIPAA security risk analysis, I mean, that's the lowest bar, by the way, in the industry to just show a fundamental effort on data security and HIPAA privacy. If you adopt a HIPAA security risk analysis or a NIST cybersecurity framework, or do something that encompasses your security program, documents it, and shows due diligence that prior to the breach or the complaint that you're actually doing stuff, that's the first thing that they're going to ask for is, what have you adopted a framework? Have you done HIPAA?
So, you know, in summary, it is a tightrope walk. You probably feel like that you're walking along with these requirements, but safe harbor, again, in summary, is adopting a framework is a catch phrase that you'll hear, you know, often. And I think it's something you need to ask yourself, have we adopted a framework? What framework is it? And by doing that, it will help the organization.
Yeah, a framework is like a next step up. The minimum is a HIPAA security risk analysis. When you complete the risk analysis, particularly using our software, the data is mapped to NIST, it's mapped to CSC, it's mapped to COVID, it's mapped everywhere so that you can export it and use it. A lot of our larger enterprise size clients are using the data because the HIPAA One is so simple to collect the data and validate it. It's now very valuable and can be used to API into other platforms, or just be downloaded to CSV for the use of the CISOs and IT security folks that their data is king. So
here's one of the questions we have. Data breaches, why do they keep happening? This is a continual problem. Quick answer is it's very lucrative for these cyber terrorists. You know, we're finding that security measures and these are doors and windows within your organization are being left open. We also find some employees are actually holding the back door open for these cyber terrorists. So there's some things that you need to understand, and this is why it's important to complete this comprehensive security risk analysis. What it does is helps you identify the gaps in compliance. Where are we at risk as an organization? And then you can put a corrective action plan in place and prioritize those risks based on, you know, which event is most likely to happen, or what's the high risks that we need to deal with. So that is the purpose in going through this exercise of going through your physical, administrative, technical, and organizational safeguards. And there's a lot of different ways to do it. You can do it on your own. There's many different vendors that do it. You can hire vendors. We offer an alternative, a software that's like TurboTax, that's super easy to use, answer some questions, and we'll show you that here in a minute.
Mm-hmm. Yeah, to your point, Bobby, it is extremely lucrative. Cyber criminals, I mean, everyone knows of someone now. Hopefully you weren't victim to it. It just sucks to be in that situation that have suffered a ransomware attack. Because what's happening now is it's not only a ransomware attack holds the data ransom, holds the network and servers and all the portals and all the data, but now cyber criminals are getting more savvy, bless you, to not only ask for money to release the information back, you know, to be functional, but even those entities that have the backups, that don't need to pay the fine, they can restore their own data. If they don't respond, then we're seeing this now just with one of the Apple subcontractors. Is not only are they going to charge for getting the data back, but if that's not valuable enough, they'll say, well, now if you don't pay us, we're going to release your information on the web, all of your data.
Yeah, and if I can just interject, it's ironic. I just got an email this morning from an entity, and be vigilant when you see these emails come in. Hey, password reset, Microsoft Office 365 password reset. And it was an urgent, you know, get it done. You click on the link, enter in the information, and boom, they've got you. So look at the sender. Always be suspicious of these emails coming in. And I think if we're training our coworkers, our employees, this is how these breaches are happening. And you're only as strong as your weakest link. So it is important. Double check. And it was interesting. It was a UK address, so I obviously blocked it this morning. But we're a cybersecurity company, and they're targeting us.
Always.
It's ironic. Healthcare, very lucrative, and it's not going away. Their attacks are going to be a little more intense, but there's a way you can thwart those attacks.
You stay high level, and we look at the trends of what's happening. A few years ago, it was even today, the hospitals are still mulling over moving from on-premise servers or on-premise, like in the data center, virtual or physical servers moving towards the cloud. There's still apprehension there. Obviously, it's hard to change the way that things have been done for a long time. Many hospitals are looking. We've actually received quite a bit of feedback and questions about this Microsoft HIPAA white paper that we wrote. Microsoft approached us a couple of years ago. Actually, we did one for Windows 10 as well when there was the Windows 7, was going out of production. We had helped Microsoft draft a white paper for healthcare on how to make Windows 10 HIPAA compliant, and then that was very successful. And we came back and wrote another white paper researching how Microsoft 365 can facilitate HIPAA, particularly for healthcare, hospitals and clinics. You've got many different departments. You've been acquiring different clinics. Everyone's on different systems. By migrating towards one platform, one set of policies is the goal of every CISO and every CIO across the country. So we drafted this white paper. We encourage you. This is a free resource. You can look it up on our website or just search HIPAA Microsoft 365. And our web paper will be at the top there. So what do you have to do? You have to have documentation. So not only your policies and procedures, but proof that you did the risk analysis. A report, HIPAA One single click for that download report specifically designed for these types of audits. Did you complete a quality security risk analysis? Unless you're uploading pictures of your new puppy dog to replace what should be a policy and procedure, your risk analysis is going to be accurate and complete using the HIPAA One software. Ongoing monitoring. What processes do you have in place to not just do a risk analysis once a year, but the outcome of the risk analysis? Are you looking? Do you have detective and do you have detective and even proactive controls, but at a minimum detective controls in place, or even retroactive controls in place, like log reviews to see if someone's trying to hack into your environment? Have you identified your business associates? All of the hospitals here have at least 50 or more business associates you're exchanging EPHI with. Who are your business associates? Do you have a current business associate agreement? Are they handling EPHI? Do you know who your business associates are? We just did a call down campaign, and I can tell you the vast majority have the intention to do these things, but very few have actually done it. And your response team. So when you have that breach, or when you have a breach occurring, do you have a security incident response plan that identify who's supposed to be looking at, managing the problem? Do you have a step-by-step plan, and do you have forms in place to capture what's going on as it happens? All of this stuff is gold, because you're going to need that during the audit, and odds are you're going to have to respond to an audit because of a breach at some point or another. And if you're not doing all these things, your chances of having a breach, given enough time, are 100%. So why are we not going 100 miles per hour with our risk analysis? Well, the risk analysis are time consuming. It's more administrative burden, like we don't have enough to deal with. We got spreadsheets. We're not sure who did what when. Is it accurate? Is it complete? Where's the one, their OCR is asking for a risk analysis from 3 years ago. Where is it? Well, internal resources, do you have the resources? Everyone's usually just trying to keep things up and performing well. Do you have any tracking or reporting? Are you measuring anything to do with your risk management program or cybersecurity risks? And with the constant changes and flux that we're in about acquiring new clinics and new departments and merging with different hospital systems, that complexity makes it even more difficult for folks to get their arms around how to address it. And we're going to cover how to do that here in just a moment.
Yeah, and before you switch, to your point, Steve, administrative burden, we find we've got about 7,500 client sites. We find, based on the size of the organization, are you a small hospital? Are you a large, hospital, community, critical access, FQHC type? Depending on the organization, we find it might be an office admin that's wearing the hat of HIPAA security officer, not somebody that is necessarily trained on it. And so there can be a little more complexity with understanding what the discussion here moving forward. So did you complete your HIPAA security risk analysis in 2020? I know 2020 is becoming a distant memory for some of you. For others, it was a nightmare. It's over. For 2021, how did you fare out? Just out of curiosity. Yeah. So sharing the results here, 67% of you completed a HIPAA security risk analysis. That's awesome. 33% did not, and there's many reasons why.
This is the first poll I've ever seen where no one has answered not sure. So good work, folks. Good work.
Excellent. So next question I want to tee up, and we're just going to hit these questions. We're audited tomorrow. Those of you that completed the security risk analysis, 67%. If you completed that, are you 100% confident you would pass if the OCR audited you? So this is always an interesting, and I'm just going to I'll talk a little bit for about 10 seconds, but give you a minute to respond. This is always fascinating to me. So I'm going to close the poll here and share the results. 100% of you are not confident. Why are you not confident? And here's some of the answers that we often hear. Well, we didn't follow a framework. Not sure what the requirements we may have missed.
Was it completed?
Absolutely.
If you're using a spreadsheet, what is the end line? At what point do you know that we are now officially
you started?
done? Yeah.
You started, but you have no end date. Yeah. That's a great point. And this internal thing with spreadsheets, it's hard to track. It's hard to update. It's hard to collaborate with others in the organization.
Or maybe we're missing some clinics, or maybe we're focused on the hospitals, but not doing the clinics because each clinic is managed independently by different office managers. Yep.
Yeah, so there's a lot of different reasons, but our goal is to take the burden and stress and your lack of confidence, put it on our shoulders and let us handle that for you.
Last question, we promise. This just helps us guide the content of the rest of the webinar.
So how did you do your security risk analysis? Was it done internally? Did you do it on your own? Was it done by an external third party? Or we have not performed an SRA. And a lot of we have thousands and thousands of FQHCs that use the software. I always tease them and say, you know what that stands for? It stands for we don't have any money, to do anything, because they do so much work and they have very, very little budget to do it. So anyway, let's close the poll here and share the results. So looks like about 67% did it internally. The biggest challenge we see is that you might question your methodologies. Did you do it correctly? External, that's good, and didn't perform them. So thank you for that.
And thank you for being honest. It takes a good relationship with one's ego to be upfront, and this information does not get disclosed who answered what. So
nope.
We're in good shape there.
Shifting gears, understanding HIPAA compliance and your responsibilities. So there is a framework, a roadmap that you can follow. A HIPAA security risk analysis, it is absolutely critical and a foundational piece of your cybersecurity HIPAA initiatives. The reason it is it helps you identify the gaps. Where are we vulnerable? Where could we have a potential breach? Once you know that, you can create a roadmap to fix that gap, or close that window, lock that door. Maybe you have a door and it has a lock and the lock's broken. Fix the lock. I mean, that is the benefit of going through these questions: physical, administrative, technical, and organizational. And then it also gives you ongoing updates. What are the triggers for performing a security risk analysis? A breach occurs a little too late. If you haven't done anything in the past, you're unfortunately you're going to be in a bad situation. So we want to quickly identify what happened, where the gaps were, fill out an incident report. It is very important for you to know if you're participating in the MIPS program. Those that answered no, we haven't done a security risk analysis. This is actually a prerequisite. About a year and a half ago, January 1, this became a requirement. It used to be part of the ACI score and contribute to some of the reimbursement. Now they've pulled that out of the score and put it and front loaded it and said, look, this is the bare minimum. You need to perform a security risk analysis if you want to participate in this program. So just a heads up there. Your responsibilities under HIPAA. So we talk about conduct regular security risk analysis. What does that mean? How often is that? We see an auditor that comes in from the Office for Civil Rights. They're going to ask you for your security risk analysis this year and last year, and they can go up, to several years. So that to me indicates, because there's a lot of confusion, it is conduct a annual HIPAA security risk analysis. So each year. Second is creating a remediation plan. This is part of your responsibility as an organization. The nice thing about it is our software does it for you. You don't have to do a lot of the thinking there. We'll find the gap and give you the corrective action. It might be a policy or procedure that needs to be implemented. We give that to you. Second is develop those policies and procedures. Keep them updated. You want to make sure if they haven't been done in the last 2 to 3 years, we get a refresh on those. And then train your staff annually. This is critical. We're finding that those organizations that train staff consistently, and we have some, complementary training software available to you. As COVID hit, there was a lot of changes, and so we put together a free module there. You're welcome to have access to that. We also have some paid training modules, but those are very, very important as we look at this. And then you want to document all your efforts, and especially get those business associate agreements signed with your vendor. We also have another product that helps you organize those business associates. There is no fee for that service as well. You can use that to track and sign and also receive assurances that they have performed their security risk analysis.
It may be worth mentioning also, we do have a complementary software that we released last year to assist in collecting the BAAs and asking for them for assurances to show what they've done recently in terms of making sure that they are protecting and they've done a penetration test or a cybersecurity assessment of some sort to give you assurances that that they're protecting the patient data you're giving them to conduct business on your behalf. Because through the chain of trust, if there's a breach through one of your business associates, you're the one as the covered entity that needs to report it not only to all of the patients, even though it was no fault of your own, but also to Health and Human Services. So Steve, a lot of liability there.
Want to ask a question? So that is what the BAA tool will do. Talk about the next level. If they want to take it to the next level, some of the services that Enterprise Health
we've got with the audience, with the sophisticated audience we have on our webinar today, maybe like we ask one question: what have you done? Please upload it. But we've got larger health plans, integrated health networks that would like to get more data on their vendors because they are adopting a framework. The real big focus of it is to understand who your external stakeholders are, who your supply chain involves, and what are they doing in order to protect the data that you're responsible for. Through the acquisition with Enterprise Health, we now have access to a program called Blueprint Protect, and it's awesome. You can make custom questionnaires. It's all based on NIST and OSCAL compliance, and if you want to get technical, we can do another webinar on that. But what you can do is you can distribute surveys out, and instead of using spreadsheets like most of you are, it's very time consuming. The Blueprint also has a managed services side that will conduct those assessments on your behalf, and then you can log in and access the results of it. You don't have to worry about the process. We take care of it for you. So there's multiple levels there. The Business Associate Management Tool, otherwise known as BAM, is available with a subscription to HIPAA One. The next level is Blueprint Protect.
Excellent.
To manage that liability.
All right. So approaches to performing your security risk analysis. Let's spend a little time talking about those. So you can do it internally. We've identified today that a lot of folks do that internally. That's definitely acceptable. You can use spreadsheets. There's an SRAT tool that HHS created. That is a free tool that's out there. And with anything that's free, Steve uses the term free like a puppy. There's dog food, there's shots, there's when it tears up your living room couch, there's a cost associated with it, and it's usually your time, and you've got to calculate your risk. They don't provide corrective action plan, but again, it's at least a framework. It's better than doing it on spreadsheets. External assessors, this is typically an expensive process. When you hire somebody, a KPMG, a Deloitte, to come in and audit the organization, most smaller and medium-sized hospitals don't have the budget for something like that. And then the final is software and assessor assistance. So that is what we do. We follow an approved framework. This is performed by subject matter experts. I mean, this is what they do day in and day out, and they utilize this software to automate the process. So that's good, and it happens in a three-phased approach.
Yeah, anyone that does a risk analysis knows how much time and clicking it takes to use a spreadsheet and try and convert that into a Word document. It's a nightmare.
An absolute nightmare.
Why we use computer systems. It's 2021. Let's use the computer system, answer some questions, and let it compute and tabulate everything for you.
Absolutely. So there's a couple different approaches. A little a la carte menu you can choose from. Hey, we're sophisticated. We could do it on our own. That would be called a self-assessment. You buy a license to the software and navigate through that process at your own cadence. A facilitated remote assessment. This would be a scenario where a hospital say, hey, look, we've done it in the past. We want a third set of eyes looking at our policies, procedures. We want some of that review. from a professional, and then we want you to sign off on that at the end. So that would be a step up. And then there's also a validated assessment that is a lot more in depth. And we can talk to you. We always get the question, how much? Well, super easy to give you that information based on how many physical locations are included. How many employees do you have? Is it 200? Is it 2,000? You know, how many employees? How many EPHI systems? What are you, are you using NextGen, Athena, Epic, Cerner? It depends. We do NextGen's assessment for NextGen and QSI properties. So guess what? We have a lot of the answers that need to be addressed by your EHR vendor. We can help you pre-fill those. So there's a lot of advantage of using the software. But once we identify that information and understand the assessment type, it's really easy to give you pricing for your organization. I think you'll be surprised how affordable it is. So moving along, so using HIPAA One to complete your security risk analysis, we'll go through what it is like to use that. So it's a software-driven assessor-led approach to compliance. And it's, again, I mentioned a little earlier, it's always nice to have that third set of eyes. You've got an organization that is always up to date with the latest OCR audit protocol and NIST methodologies. As those state and federal changes take place, you don't have to deal with them. You don't have to be searching on the internet, what changed for 2021? Well, Safe Harbor did. And guess what? We've already got questions in there so that you don't need to worry about that. Just answer the questions in the software and you are compliant. It's nice to have access to a certified auditor, somebody that's designated specifically to your organization. You'll have their name, their phone number, their email address. If you call me, I'll give you their home phone number and cell phone if you'd like. No, I'm kidding, I won't. But it's nice to have that subject matter expert, that trusted advisor that can help hold your hand through the process. And then maybe year two, you don't need them anymore. Use the self-assessment mode, and I'll show you some of the import features for next year that'll save you about 75 to 80% of the time to do that. But it gives you a place to manage all your data in one area: security, privacy, business associates. You've got it under one pane of glass, and that is key, instead of spreadsheets that are disjointed. They're not collaborative in their approach. So just a couple quick things will help you with your gap analysis. We calculate the risks. That's what the software does. Also, the remediation tracking and action history is nice, and I'll show you that here in a second. You've got real-time reporting and analytics based on how you answer a question. It will produce different graphs.
Okay, we've got one question here. What is a PBRA? That's not a type of beer. It's actually privacy and breach risk analysis. So the security is what we're focusing on, but we also have privacy and breach risk analysis that introduces the state-specific laws that are more stringent than the federal ones based on the state. So we address that complex patchwork of different HIPAA privacy rules across the country. So just wanted to answer that question as well.
Excellent question. So I'm going to go through a three-stage process. I want to break it down very, very easy how you perform a security risk analysis. Step one is information gathering. We have a reflexive questioning engine that's going to tee up questions, and based on how you respond, serve up different approaches. So that's step one, is gathering the information. We will be presented this assessment checklist. I need to put my business information in a number of locations, EPHI systems, and then assign roles to different individuals throughout the organization. Those little question groups are HR questions, HIPAA security officer, facilities manager, IT server, and IT network. Now, the beauty is if you have a managed service provider or full-time IT staff, 30% of the questions you can delegate. So that takes 30% of it off your plate already. HR has about 9 questions, and the little red and green Christmas colors that we have up there on the screen show you how far you are in the process of answering the question. So you can see HIPAA security officer hasn't even answered. The nature of the question is this: that little gray section on the right-hand side is the regulatory text, and you'll notice the HIPAA citation. The left-hand side is our interpretation of that text. So we ask a very basic question. Do you have a policy and procedure where HR notifies IT or staff of terminations, departures? There was actually a really big brief tangent on this specific question where HR says, oh yeah, we do. And IT, we ask the same question of IT and they say, no, we don't have a process that does that. There was a big breach where somebody that was terminated accessed protected health information, and there was a large fine that followed. That was a recent one in the last 2 months. But back to the question, if you answer yes, it's going to say, wonderful, you have that policy, prove it, upload it. It needs to have been reviewed or updated in the last year. What if we say no? If we say no, not a big deal. It says, here is that policy and procedure. So you can see this as kind of a choose your own adventure path. Now, what happens if it's not reasonable and appropriate for our circumstances? Well, you have the ability to just document that and move on to the next question. You also have the ability to flag questions. I don't understand what this means. Does the organization have a policy and procedure where blah, 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 blah? I don't get it. This is where you can flag it, ask our auditors, come back later.
It's one of the, this is a feature that we introduced along with multiple delegates, meaning you can assign multiple people to answer these questions. So currently, our clients use this functionality mostly to say, Mary, I need you to answer this question. I don't have the answer to this. And then we'll add Mary as a delegate. They get an email, they click on it, log in, and they're now presented with their questions to follow up. So the flag functionality helps collaborate across large departments and even cross-departmental efforts to make this happen.
Absolutely. So now we've done that. Phase one is done. Step one is complete. Step two is the remediation planning. So what we do,
and if I may interject here, we just took all the responses from all the questions and clicked on remediation plan, and in less than a second, the results are presented immediately. It's very important to note that this just saved 8 to 20 hours of a consultant or full-time person internally combing through all of the responses to the Excel and then trying to come up with, okay, what do we do now because these weren't answered right? So the software does that automatically in less than a second, pretty much instantly.
Yeah, it's interesting. We take for granted how much time it saves. It's just like, well, here's the next magic step that happens in the process. So this remediation planning, I want to touch on a couple things here. You can see starting at the top, risk, threat, vulnerability. So it identifies those items up at the top. We also have compensating controls that you can add in here. But this is where one of the key features that I love, we can assign an individual to this specific task. All I need is their email address, and then I can enter a target date. I need this completed by, it's April 27th day. We need that done by June 5th. Perfect. That action plan down in the bottom will tell that individual exactly what needs to take place. And it creates what I call the auto harass feature. It's going to ping them and say, hey, you've got 3 high risk items that need to be addressed. Get on it.
It's only once a week, but yes, it is the auto harass feature. It's a great way to word it, Bobby. Everyone gets it.
It's a good reminder, and I think it helps move the HIPAA initiatives forward with these little auto reminders. So you don't have to do that to your spreadsheet. I mean, that's the key.
And there's the HIPAA citation that specifically calls out taking actions on the risk analysis as well to implement reasonable and appropriate measures. And by having the software do that, you're automatically compliant with that requirement.
Absolutely.
That's what we're all about.
So step 1, step 2, and then step 3. Step 3 is the final reports. A couple things I'll point out on this screen. You can't get to this screen until you answer the questions. Step 1, remediate. Step 2, or at least put a corrective action plan in place. And then this is the ongoing living, breathing part of the software.
So what actually happened was that the report was generated, and if anyone had this done, there was a lot of folks that had it done by third parties and internally. The report takes a long time to do. If you get it outsourced, you're looking at 4 to 6 weeks. If you're doing it internally, you're looking at 2 or 3 days of your life writing that Word report. So the software does it between 8 and 12 seconds, depending how large your organization is, and it's ready to go. And then what is that line of delineation? When do we know the risk analysis is actually done? There's a button to click to sign off on it.
Absolutely.
And now we're presented with this screen on what to do next.
Well, and a couple nice features, reviewers. Let's assume CEO did not really have a big role in answering any of the questions, but wants to see where you are as an organization. Right here, all I need is the individual's name and email address. They can log in and see the current risk status, the high, medium, and low, and what's unaddressed, opened, and resolved. So it breaks it down into those categories. They also have the ability to see risks that have been updated over time. Oh, we're doing great as an organization. We did 2 in November, 1 in January. This shows progress. It'll also provide a letter grade for you, and that is key. With this letter grade, you'll see that increase rapidly as you go, throughout the process. And then finally, you have the action plan and the final report that is available to you. And as Steve mentioned, it generates it in less than a nanosecond. It's perfect every time. So the other nice feature is we can log into the software anytime, go to the action history list and pick an item to work from. And then as we enter in some of the actions that have taken place, policy and procedure drafted, it's pending approval, performed by. Once I click on risk remediated, it'll update all those different graphs that I just showed you.
Yeah, it's also important to note that the final report that we're going to look at here in just a moment, Appendix E updates automatically with those changes. So you don't have to. We're a big believer that you enter the data in once and use it many times.
Absolutely. So here's the final report, just to give you an idea of what that looks like.
And these are customizable too. You can actually, there's a custom report button there. So this is used, sometimes all you want is a couple of the sections to be included in a PDF to give, depending on the audience that you want to respond to, or you want the whole thing, obviously if you're being audited. So absolutely. Just a few extra features that have been put in there per our clients' requests.
Thank you. I want to give you a slight glimpse of the future. We're coming down the home stretch, only have a couple more slides to share with you. But this, you're looking, what is this? Select assessment import. This is what your life could be like year 2. You come in here, you have, we just completed a large organization. They had about 340 hospitals and clinics. And how do we import? Super easy to do. You come in and you select those that you want to import. Everything from last year populates into the new year, and then you're only addressing some of the changes, any significant change that has taken place within the organization. So that import feature alone will save you, as I mentioned a little earlier, about 75 to 80% of the time you invest in year 1.
Yeah, a lot of clients will do like a facilitated remote in year 1, and then do maybe a facilitator remote in year 2, or because of they want to have a lower budget, they can have do a self-assessment importing their work from last year, and then have the assessor come in years 3 or 4 and start the process over again.
Absolutely.
So save time and money, and everyone likes a lower cost in year 2 for a compliance program.
Yep. So I get the question, how long is this going to take me to do? So HR has 9 questions, about 30 minutes. And this isn't uninterrupted 30 minutes. This could be 5 minutes in the morning, and then a couple days go by, another 10 minutes. You can log back into the software, but by and large, 30 to 90 minutes is the time frame that we have estimated from doing this. We've got about 7,500 client sites that do this every year. So this is very, very good data, so that you're looking at this going, okay, I didn't spend that doing this on my own. So maybe the software can help. So I want to pose the question, Steve, talk to us about multiple locations. Mm-hmm. I shared a scenario. We had 340 locations, handful of hospitals, and then lots of clinics associated. How do you manage an organization like that?
So if these clinics are all sharing the same EHR program, you have some advantages in that a lot of those controls, you can measure it once and then report on it many, many times. So we call that the small to medium size profile. And that would mean that you've got a lot of sites that have, similar policies, procedures. They're all kind of connecting into one. They're not really having a lot of customization or uniqueness to how they're set up. When I say that, I mean policies, procedures, governance, risk, and compliance. In those cases, we see mostly like long-term care facilities, or like Bobby mentioned, if there's an integrated health system that has hospitals and many clinics, usually there's different TINs involved, and you can group those clinics together if they're all on the same TIN.
That's a tax ID number.
Tax ID number, thank you. We are we need like a key at the end of this. Just list all the acronyms. So this is the more simple approach. So what we'll do is we will add one remote location per assessment, so that way on the final report, the scope includes all your clinics, which is critical when you're responding to, eligibility audit or, breach report or any type of audit. You want to have the name of that clinic on there, because even each doctor will associate their API score with an NPI. Oh my gosh, more acronyms. Everyone knows what that means, right? Whereas the hospitals will be attesting and submitting on their own behalf as a hospital. So you can add those locations here, and then we can do one-to-many updates. Now, what happens if we have more of a national approach? We've got different operations in different states with different TINs. We have wholly owned subsidiaries, we have partnerships, we have marketing, flying over. Those are very different, and those are complex, what we call parent-child relationships. So what we do here is we have this is how we seamlessly scale from small single doc practices all the way up to complex health insurance plans with hospitals and clinics and multiple covered entity functions, health information exchanges as well. We have this function called active templates. And basically what it does is it gives us the ability, we're going to say, okay, where is most of your stuff centered at? Usually there's a headquarters, there's a corporate, there's some type of holding entity that manages a lot of the administrative functions of all of them. So we do a risk analysis there, and then once we complete it, we export all that data into a template. This is a different database entity. We can now manipulate that template and create different assessments based on those profiles of different tiers of children of that parent. And we can pre-fill those questions based on what we want. Maybe we want certain questions pre-filled with the contents, other ones we want to find out what they're doing at the remote sites. Once those risk analysis are completed and updated, they go back into the template update queue. So what this does effectively is it creates a life cycle where we can constantly audit and be updated, and this process will refresh particular HIPAA citations to find out what a complex organization's control is at any point in time. I don't know of anything else on the marketplace that does that, unless you're looking to spend a tremendous amount of time, energy, and resources to learn the platform. Our software is simple and it's all integrated.
So Steve, this looks like a lot of information. I just want to point out this setup takes less than 30 minutes, and our auditors help you do that. If you're feeling like, oh my goodness, this is a lot to take on, just know that the software automates the majority of that, and where the software doesn't, you've got a trusted advisor that's going to help you set this up. But it's very quick. We just need to identify some key components to the organization. So we are done. If there are any additional questions, I want to ask one more question from you before you enter any questions in, if you have any. We've talked about a lot of things today. What would you like to learn more about? Security risk analysis, like how much would it cost for our organization? Are we doing it correctly? There's no,
how do we approach it?
Exactly. Yeah. There's no, you'll find speaking with our members of our organization is very educational. They're not going to try to sell you on anything. But do you want more information about security risk analysis or privacy? A lot of people don't know that privacy software even exists. HIPAA workforce training. We have some, as I mentioned, complimentary training, and we have some paid training for your work staff. If you have something in place, awesome, do it. If you don't and you need some assistance, we have a lot of those modules built out. The vendor management tool is an interesting one. A lot of people are interested in that, partially because it doesn't cost anything, but it allows you to organize and utilize electronic signatures, loading your template, sending it out to your vendors, and tracking it in one area instead of piecemeal. And as they negotiate and rewrite and edit and redline, those changes are tracked, and the final result will be signed electronically. So that's a wonderful tool. We can even go one step above and beyond that, as Steve mentioned, with some services and help you with these vendors and finding out if they've done their security risk assessment. If they haven't, there could be a potential breach from them through you at the end of the day. And I hate saying this, but you're the one that holds the bag at the end of the day if there's a breach related incident, even though if it might not be any fault of your own. And then the other thing is remediation services. We have several of our clients that say, look, okay, we've identified holes in our boat. we don't know how to patch the holes. We don't have the equipment. We don't have the knowledge or the know-how. Can you help? And it's been fun with some of our large clients and small clients to come in and say, let us help you in this little area that you don't have a trusted advisor or a subject matter expert, and really help you. So anyway, I'm not going to show the results of that poll question, but we appreciate your time. We know you're busy. We appreciate the healthcare community and having navigated a year of pain and uncertainty and frustration, with the pandemic, but we got through it, and keep plugging forward. This is an area that we need to be vigilant so that you don't find yourself in a situation where you're struggling as an organization, and then all of a sudden you've got fines that follow that, and the embarrassment of being on the news and on that site. I mean, it's preventable. So there's a lot of things that we can share with you on how and what to do that don't cost you a dime. So if you have any questions, please, give us a ring. Again, very, very happy to help any way we can.
We really appreciate you attending our webinar today, and hopefully you can reach out. We'll only reach out to you if you want us to reach out to you, and we'll provide as many resources as we can to help you navigate HIPAA and cybersecurity risks through 2021 and into the future.
Awesome. Thank you. Have a wonderful day.